Hello, welcome to VMC. I'm Dr. M. Is your pet at risk for Lyme disease? Join me as we are going to cover the signs, symptoms, prevention, and treatment for this disease in today's video. You'll learn something today. So what is Lyme disease? Well, it is caused by a bacterium called Borrelia burgdorferi. The bacteria are transmitted to humans and to other animals after they've been bitten by an Ixodes tick that is carrying it. Now, it's important that we remember that ticks can carry multiple diseases, so it is possible that animals may have double infections. The most common infection after Lyme disease is anaplasma, but we can cover that in more detail in a different video. We also need to remember that not every tick carries Borrelia burgdorferi. The infection rate of ticks does vary dramatically from geographic location. So if you do happen to find a tick on your animal and you take it off, you can save that tick and it can be sent away to be tested for different tick-borne diseases. We also need to remember that a tick needs to feed on an animal for 24 hours or longer before it will actually be able to transmit this disease. Only a serological test will confirm if your animal has been infected, and we can usually detect these antibodies to Lyme disease 3 to 4 weeks after the bite occurred. So Lyme disease can also impact people. However, people are not being infected from their pets. What's happening is that the ticks that are carrying the Lyme disease are also biting people as well as the pets that live in the household. So preventing exposure to ticks is very important, and we have a number of ways that we can do this. We will talk about that a little later on in the video. Lyme disease has been reported in every single state in the US, but it is more common in the Northeast, the upper Midwest, and the Pacific coast. It's also found in Canada, more often in Ontario, but also in other provinces like Manitoba, Quebec, and Nova Scotia. Lyme disease is actually named after the location where the first outbreak was noted, and that was in Lyme, Connecticut. Lyme disease can also be found in different parts of Europe and Asia. The risks of Lyme disease being transmitted to people is increasing. This may be due to climate changing, where ticks are active and how long during each year they are active, as they're more active in the months where the temperature is over 4 degrees Celsius. In the last 20 years, the number of cases reported to the CDC has doubled to around 30,000 cases per year. We don't have tracked numbers for our pets, and animals, especially dogs, are at a much higher risk than people due to their increased exposure to ticks. Although cats may be able to be infected and horses can absolutely be clinical for Lyme disease, today's video is going to focus on dog symptoms, treatment, and prevention. Dogs can display several forms of Lyme disease, but the most common symptoms that we see are lameness, especially a lameness that shifts. So they might be lame in one leg, and then a few days later you notice, oh, they're actually lame in a different leg now. Swollen lymph nodes, fatigue, joints that are swelling, lethargy, and loss of appetite. Some dogs that get infected with Lyme disease will develop something we call a Lyme nephritis. This is where their kidneys are severely impacted by the bacterium. This can lead to symptoms like vomiting, diarrhea, and sometimes these animals will die. It's less common in dogs, but it is possible that sometimes the bacteria impacts the central nervous system. In those cases, we can see neurological symptoms. What is interesting is that around 10% of animals that have Lyme disease will actually develop symptoms, and these symptoms do tend to appear when the animal is in more chronic stages of the infection, roughly 2 to 5 months after the tick bite. This does make diagnosis of Lyme disease a little bit tricky. However, any dog that has lameness, swollen joints, and a fever should absolutely be suspected of having Lyme disease. It's some of the other symptoms that are a little bit more vague and can be a bit more challenging to figure out. Often we will run a blood panel in order to rule out other diseases that might be causing similar symptoms. There are in-clinic tests that your veterinarian might check in order to screen for a variety of tick-borne diseases. These tests look for antibodies that your dog will be forming in order to fight the bacteria. So sometimes we can have a false negative test if we test too early and your dog hasn't formed enough antibodies to make the test positive, or if your dog just isn't forming antibodies very well to fight the bacteria. So a positive test is meaningful, but a negative test doesn't necessarily mean that your dog doesn't have Lyme disease. Sometimes we have to send in blood work to a lab in order to have a secondary test run. So the diagnostic steps that your dog might go through can vary based on which symptoms they're presenting with. Generally, we end up diagnosing Lyme disease through a combination of history, geographical location, test results, and even response to therapy at times. So how do we treat Lyme disease? Because the Lyme spirochete is a type of bacteria, we can treat it with antibiotics, and the antibiotic of choice is called doxycycline. Treatment needs to last for at least 4 weeks, and there are situations where we may need to treat for a longer period of time. Usually we will start to see some response within a few days, which is wonderful, but there can be kind of some relapsing of symptoms over the following weeks. That is a fairly normal treatment course. Dogs that end up having Lyme nephritis or maybe central neurological symptoms may end up needing additional medication to support those other symptoms that they're having. There are also a number of dogs that need pain management while they're going through their treatment. This is because swollen joints can be very painful. At this time, if your dog tests positive for Lyme disease but has no symptoms, we generally do not treat them with antibiotics. There is a little bit of debate amongst experts on this, but currently most of them seem to concur that without symptoms we should not be treating. This is because of the possibility of a false positive test, and we really don't want to be causing antibiotic resistance. So if your dog does not have symptoms and test positive, they may not receive a course of doxycycline. If you've been on VMC for any period of time, you know that I love to focus on prevention. I would much rather you prevent your animals from getting sick rather than having to treat it in the future. So let's cover the best tools that we have in order to prevent Lyme disease. The first thing that we need to focus on, and the main tool that we have, is using proper research-based tick prevention medications. There are a couple that are available over the counter. Many of them are only available as a prescription from your veterinarian, and based on your geographical location, it will depend on which ticks you have around you, which species, as to which prevention your veterinarian may end up recommending. We have some that are topicals, we have others that are given by mouth. Both of these can work because, remember, as we mentioned earlier, the tick needs to be feeding for at least 24 hours before it has the opportunity to transmit Lyme disease to your dog. So even the medications that are given by mouth will kill the tick before that 24 hours has passed, which is why they are still an effective prevention tool. Back when this vaccination first started occurring, the vaccines we had in the past did seem to cause more side effects. However, we have newer iterations of the Lyme vaccine now, and if you live somewhere where Lyme disease is endemic, you need to be discussing this with your veterinarian. It's important that we remember not all vaccines are 100% perfect, but it is an additional line of defense in order to help protect your dog from getting Lyme disease. Where I practice every year, we'll see a couple of cases that get really sick, and some of them end up dying, and those are usually the patients that have not been vaccinated. The ones that seem to be vaccinated, if they get sick, they seem to get less sick. I vaccinate my own dog against Lyme disease because of this. It is a vaccine that requires a booster once a year, and it's just an important one to consider depending on where you're geographically located. If you're somewhere where Lyme disease is a lot less common, it may be best just to be using a tick prevention and to not need to vaccinate. How the vaccines work is that they will cause the dog to produce a borealicidal antibody. What will happen is those antibodies will end up neutralizing the bacteria within the tick so that it is unable to spread Lyme disease to your dog. These antibodies will end up working in the tick's gut during the blood meal, and it will sterilize the bacteria within the tick so that it is unable to transmit Lyme disease to your dog. Lastly, if you are in an area where there are a lot of ticks or where Lyme disease is endemic, it is important to check yourself and your animals for ticks every single day. I believe it was on the podcast Ologies where they were talking about ticks, and the phrase that came up was to remember to check your crevices. That's stuck with me. So you need to remember to check your crevices and the crevices on your pets every single day for ticks. And this should be done every day through the higher risk times of the year, which is usually spring, summer, and into fall. If you happen to find a tick on your animal, you need to remember that it's important to remove it properly, because if any mouth parts are left behind, those can still transmit the Lyme disease to your pet. Remember to also wear gloves while you're removing the tick, because we don't want to risk you infecting yourself with anything as you're taking the tick off. If you find a tick moving around on your pet, it has not fed yet, and you can just remove it promptly and place it in rubbing alcohol or crush it between two hard surfaces. If you find a tick that is implanted on your pet, then you need to grasp it with some tweezers, or there are some tick removal tools, and you need to very gently but firmly pull straight out. Take care that you are not twisting or jerking, as that increases the likelihood of mouth parts staying behind in your pet. You can always see your veterinarian if you're unsure about how to remove the tick, or if you know that mouth parts have been left behind. You can also save the tick and ask your veterinarian about submitting the tick for testing. There are some areas where testing it is free as part of monitoring and surveillance. In other locations, there may be a cost associated with it. You'll need to talk to your local veterinarian and find out. In general, we want to prevent as much as we possibly can when it comes to Lyme disease. However, if your dog or other pet does end up being symptomatic for Lyme disease, make sure to work with your veterinarian closely in order to treat as soon as is possible. If you wish to tell me about a time when you found ticks on your pets, or if you've been through having to treat Lyme disease, feel free to tell me all about it. If you have a topic that you'd like me to cover in the future, don't hesitate to leave that suggestion in the comments below. I do read every single comment that you leave for me, and I very much appreciate hearing from you. I hope that you have the most wonderful weekend, and we will see you next Friday. Bye! Remember to check your crevices. That's stuck with me.